This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and Happy New Year. We hope that you made your resolution and you've kept it till this time. It was 3 days, right?
That's right, John.
I kept mine 5 days one
Come
time.
on, John.
All right. Good to have you with us as always, our first show of 2021. And it's a pleasure to have your company for the next hour as we discuss a variety of issues, all of them, of course, related to health. And we do that with the one and only Dr. Molly Fantasia, the PhD doctor and the executive director and the founder of Innovative Medical Associates in Marlton, New Jersey. We'll do the usual, the who, what, when, where, why, and how of Innovative Medical, and we'll talk about some things that are probably happening in your life for the new year, and we'll make some suggestions. And, of course, if you have a question or you want to jump into the conversation, 855-839-1210, 855-839-1210. That is the number here. And feel free to jump in at any time and call with your question or thoughts for Dr. Molly. Happy New Year, Dr. Molly.
Happy New Year to you, John, and to all our listeners. And I want them to have a healthy one.
Did you make any resolutions?
Yeah, I did, actually.
Okay.
I think Dr. Molly's going to take better care of herself as well through this new year.
Right. And I guess you made a resolution to have your therapy dog have more schooling, right?
Oh, well, let me tell you something. Actually, we were very lucky, a little side fun. We took Gracie in on Thursday because, it was a light day.
Yeah.
And, and guess who was there? Lucky and her mom and dad and Gracie. Well, they tore through the clinic and they brought a lot of joy and happiness to a lot of patients. So we were thrilled.
Well, maybe you'll start a kennel one of these days.
Well, I don't think I'm going to start a kennel, and we had to do infection control. So no, I'm not starting in a kennel because I needed the days. Yeah, right. But it was a fun afternoon.
All right, 855-839-1210. Let's start the new year by talking about Innovative Medical, what you do, what sets you apart from others, and how you can start the new year off right with your health.
Well, John, I think the most important thing is to say that we are a cooperative of healthcare providers who've come to this conclusion that there may be a better way to proceed in terms of quality of life. We just are a group of people who've come together, and we're all working out of my facility, which is a primary care facility. So, again, if you need prescription meds, you're going to get them. But our philosophy is let's try our best to reduce the need or the dosing of the prescription meds, thereby reducing the side effects and allowing people to continue a good quality of life regardless of where they are in their health continuum.
You've often talked about prescription meds, and you're not against them.
Absolutely not.
But you kind of work it in with the nutraceuticals.
Right,
so
exactly.
Talk about how you make that balance.
Well, we try, first of all, we really research our nutraceuticals, and so we know which nutraceuticals can contribute to someone, for example, if they have hypertension. We know this because we've done the research, and that's been the bane of my existence for 24 years, and I'm still learning all the time, always researching. So, again, if you need hypertensive meds, we're not going to take you off of that. If you have high cholesterol, we can't maybe take you off your meds, but we can augment this by utilizing hydration and utilizing that as a delivery system for the natural substances like the vitamins, the minerals, amino acids.
You mentioned hydration. You deliver your nutraceuticals via hydration.
Right.
But in the hydration bags that everybody gets, everybody doesn't get the same bag.
No.
But what is in those?
Well, we use vitamins, vitamin C, vitamin Bs, vitamin A. So there are many things in there. We also use amino acids, and that could be glutamine, it can be arginine, it can be number of things. We also use minerals, trace minerals. Everybody's talking about zinc right now, right?
Yeah.
Zinc because of COVID,
Right.
of course. So we've used zinc in our immuno-enhancing IV. So again, what we're doing is we're balancing. We believe, as I always say, the Goldilocks theory. Not too much, not too little. It all depends on the individual patient and what we're trying to accomplish while maintaining a good quality of life, and most times by improving their quality of life.
And you do that through the hydration, of course.
Absolutely.
And if they're on prescription meds,
We try
you
to
have a
help them.
doctor who
Right.
doctors
Our
on staff.
medical director, of course.
Yeah.
Should you need to be cut down? Should we need to bring something else in? You need an antibiotic? We're going to give it to you. An antiviral? We're going to give it to you. So the bottom line is we want to do the best we can for a patient in just a different type of primary care setting.
It's interesting because I always think when we do this kind of a segment, I think about when my mother was living. I'd take her to the doctor,
Right.
and she'd sit in the room. We'd sit there for a half hour. The doctor come in. Hi, Mrs. DeMasi. How you feeling? Good. Check her a little bit, and he's out the door.
Right, right.
And you don't do that.
No,
Talk
no,
about
no,
your
no, no.
process and
Our
how you handle.
process is that we want to speak to the patient. We want to know what's going on. Obviously, we want them to fill out paperwork that gives us a historical data on what's been happening within the framework of what they want to accomplish. And we need to know what our patients' goals are. In particular, in the new year, we're going to see more and more of that. Because we have people who come in who say, listen, I want to improve my muscle mass. I want to improve my overall health. And then we have people come in who have some serious conditions as well. You've seen, John.
Yes.
Cancer. We want to do cancer supportive. This year. I've been thinking so much about a lot of the folks that we've helped, and it's been very interesting because the gamut has run from some very young folks, as you know,
Yeah.
Bella, all the way up to some people who are in their 90s. So again, it depends on what the patient is looking for and what can we do to enhance their quality of life.
You know, it's interesting. I was talking to one of your patients the other day, and we were discussing how you've spoiled us.
Yes.
Because I
yes.
was telling him the story of how I waited an hour and a half for a doctor, and he said,
One I recommended, by
exactly,
the way. I know.
exactly. And he said, well, yeah, Dr. Molly spoils us. I said, yeah. I said, we never waited more than 10 minutes here.
Exactly.
You know, so,
Exactly. But you know what? You can't fault the healthcare providers either, particularly in this climate. Everyone is worried about COVID. Everyone needs to make sure they're doing the infection control. I'm a very lucky woman because I have the best infection control group in the world. Between our flight nurses, the lovely Linda, and Nurse Barbara, let me tell you.
You're covered pretty good.
We're
yeah.
covered real well.
Yeah, yeah. I wanted to ask you, because you mentioned COVID, and we often talked in 2020 about
COVID.
and we talked about vitamin C
Sure.
and developing the immune system.
Right.
And you just mentioned zinc.
Yes.
Should you be taking zinc now as a preventative for COVID?
Well, I'm not going to say it prevents COVID, but there's a lot of data out there. Zinc, along with several other cohorts, can indeed help and boost your immune system. And I think the theory about the zinc is it makes it a little more difficult for viruses to enter into the cell. So it really, everything goes back to what I believe, cell signaling. Everything goes back to the journey of the cell. Isn't that something,
Yeah,
John?
yeah.
Everything in the end is biochemical, molecular related, and that's really been the focus of what we do, too.
Speaking of the journey of the cell,
Yes.
your book, my 30-year journey in IV.
Yeah. Well, I'm working on this second volume.
The second one's coming out,
yeah,
right?
I'm
Okay.
almost
All right.
halfway done.
Yeah, we're going to hold you to that because
Oh,
we've
yeah,
been
I
waiting
wanna-
for this book.
No, I want to have it out by February.
Okay.
That's the deal.
Okay, we'll certainly inform people on how they can
Yeah,
get
of
it and all that
course,
stuff.
of course.
But you've studied this for, forever.
Right.
So you've actually perfected in a lot of ways some of the protocols to
Right.
help
The-
conditions like what we're in now.
A lot of the protocols, we all know, listen, people come into me, you can't patent natural products. Of course you can't. They're God-given, and I thank God every day that he has allowed us to use them. But you certainly can look at how to give them the synergies of various nutraceuticals and vitamins and how you give them and what are you trying to effectuate in terms of the patient. So those are the things that separate us, I believe, from the other folks that may do this.
Yeah, you've often talked about synergy.
Yeah.
And
yeah.
you've often talked about the synergy that you've developed with
Right.
the different nutraceuticals.
How do they work together
right.
to effectuate the change? That's it in a nutshell. And I think it's very, very important. So when you're talking about our patients, meaning the patients, and I have to thank God for many things, not just for allowing us to get his ingredients, but also allowing me to develop a relationship with some proprietary pharmacies so that our particular products are done appropriately. And also, I have to thank my medical directors for also doing the research with me and allowing me, if I bring up a new idea, saying, you know what, Dr. Molly, I think that's a great idea. Let's do it.
All right, we're coming up on our first break of the morning. Our show is Health Watch, and we're here every Sunday from 8 till 9 on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates in Marlton, New Jersey. You have a question for Dr. Molly? Yeah, early is a good time to call. We always tell you, call in, because later on in the show, when we get to the end, people call in and we can't get to you because we have to go off the air. So call now, 855-839-1210, 855-839-1210. After the break, we're going to talk about some potential New Year's resolutions and some ways to look at your health for the new year. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Back here on Health Watch, and as always, there's no such thing as a holiday with the operators at Innovative Medical. They are standing by to talk to you if you have a question or you'd like to make an appointment with Dr. Molly. Remember, the initial consultation is complimentary, and the number is 856-489-0505. That's the number. Innovative Medical Associates, Marlton, New Jersey, 856-489-0505. As I said, the initial consultation is complimentary, and that's where you really can get a lot of your information that you will need in order to make a more effective and intelligent decision moving forward. It's pretty simple. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That is the website. A lot of good information on that, including how to purchase Dr. Molly and Dr. Harvey Glass's skincare products that have recently been available, and people are using them and loving them. So
They are.
Look, a lot of reasons to go to the website, innovativemedicalassociates.com. Health Watch is the show, Sundays 8 till 9 here on Talk Radio 1210, WPHT. Again, 855-839-1210 is our number here, 855-839-1210. Dr. Molly, you watch TV this time of year, and all you see is ads for diets, ads for gyms,
Right.
and all kinds of
And
health
all kinds
issues.
of potions and
Right.
herbals and everything else. And listen, I'm all for all of that. The question is, I go back to the same things. Sometimes when people buy all of these products, and believe me, the new year is the time, boy, they go out and they buy a ton of product for weight loss. They buy a ton of product for more energy. All of these things, because it's all about your New Year's resolution. Well, I'm all for it. However, I believe that it's a good time to come in for the free consult to chat with me, and let's make sure you're on the right track in terms of this. Because if there's one thing you and I've learned in the 20 years we've been doing this, right, John,
Yes.
is that you can pick up all kinds of products, in particular for men's health, men's ED, these kinds of things, and almost kill yourself in doing
no
it.
question about
So
it.
listen, don't be foolhardy. Come in, talk to experts who can help you in this realm. The other thing I want to say about the weight loss, today there is so much more data collected in terms of your DNA to help you with your weight loss. And I actually have a DNA product that can test you, see where you are. In other words, it can tell us that if you take certain products, you're more rapidly metabolize those, or you less rapidly metabolize those, or we can give you some products that don't work no matter what you take. So there are things, but of course, we have to go back to good nutrition, period. Good nutrition. And when you start to restrict calories, what do you think happens, John? Do you think if you do these starvation diets and this kind of thing is good for the body?
No.
No, because the body's programmed to what? To really hold on to some people are programmed to hold on to their body fat during these things, so that's more difficult. So there are ways to do this kind of thing that do not put you in jeopardy, and I would say you want to get into some kind of program that really looks at you, the individual.
This is a good time to mention the story that I've often told, and I was at a convention, and a guy says to me, "Here, take these." He said, "You'll be able to have sex for 3 days."
Yeah.
This is what he said to me, right?
I
remember saying to myself, because you and I had been working together, and I said, "Let me ask Dr. Molly." And your statement was, "Well, you can take these, but you're not going to have to worry about any kind of sex because you're not going to be around."
Exactly. Because the interaction to what other medication you were taking. This is the things. Just because something is labeled natural doesn't mean it's good for you.
That's right.
You need to have some advice if you're on medication. Exactly back to what we spoke about in the earlier segment. We're not against pharmaceuticals. If you're on them, what we want to do is enhance what's going on to effectuate the changes you want, but don't put yourself in harm's way.
Yeah. And you remember the patient that came in to you and they were taking a product and it was loaded with niacin? You remember that?
Oh my gosh, yes.
Yeah.
Yes.
And
Yeah.
they didn't really realize.
It was lowering their blood. They were like, their blood pressure was so low that it alarmed lovely Linda. And I said, "What the heck are they taking?" And we went through it, and here they were tripling up on their niacin. They wanted to know why they were having hot flashes, why they were dizzy. It was incredible. And we found out, and we put them on some products that I knew would help what they were looking to effectuate the change in, but also putting them on a short course of nutritional IVs.
I think the bottom line here is that even if you only come in to meet you for the free consult, you'll be able to help them in terms of that kind of thing.
Sure,
because
I will.
You need advice for something like that.
Sometimes.
And a lot of times they'll go into a health food store and they'll say, "Can I have all this stuff?"
Do you know what's so funny, John? I saw someone just recently who brought out his American Express statement and showed me what he was spending on nutraceuticals in the health store. I went, "Oh my goodness!" I said, "You could have done 10 treatments here."
Yeah.
Okay.
And been better off.
And
yeah.
would have had a better outcome, and we could cut down these nutraceuticals to a few $100, and you'd be in great shape. And you'd probably come in 3 to 4 weeks after the 10 treatment and tell me how good you're feeling.
Yeah. I think the bottom line here is we want to impress upon people that getting some help, some advice when you're dealing with these kinds of products is very important.
I agree. And you can get that at the health food store sometimes.
Yes.
Okay, but it's the luck of the draw.
Exactly. And it's not the same advice as you would give.
Well,
because
obviously I don't presume that I know everything or that.
Well, you know a lot more than them.
Okay, you're very kind, John. But you know how I feel about that. Bottom line is, you want to be judicious. No matter what we put in our bodies, we want to be judicious.
I have to tell you this diet story, and this was long before I met you. I was in advertising and calling on some businesses, and a woman owned a health food store, and I said, I want to lose weight. She says, "Oh, I have the thing for you," she said. And she gave me this bottle of whatever it was. It was natural, supposedly. And she said, "Take 3 before you go to bed." Okay? And I did. And not only couldn't I sleep, but, and that never happened to me, but the next morning I felt like there was a truck on my chest.
Yeah, I believe it.
And I mean, it was one of the worst feelings I ever had. And right after that, I took it one day and I threw the bottle out.
Yeah, see, that's the issue. The issue is we don't know. You listen, John. Everybody knows you came to me with some comorbidities, right?
Yes.
And people who have comorbidities have to be more careful about what products they choose. So again, what you want to do is you want to have a safety net. And I look at what we do as part of a patient's safety net. We want to help you maintain quality of life. That's what the whole staff has pledged to do.
Explain, because you've done this, but there may be some people listening for the first time. Explain the difference between your hydration, your IV hydration, and the health food store situation that we've been talking about?
First of all, the IV nutrition or the IV hydration, using the hydration as the vehicle, is going to be a more direct hit to where we want to effectuate the change, right? If we're looking to help lower blood pressure so that you don't have rapid heartbeats, those kinds of things, we can do that. And we're able to do that with certain nutraceuticals used together with other nutraceuticals to help you in that vein. We don't cure anything, but I'm going to tell you, nothing at the health food store cures either. Don't let them kid you. They're not curing. What you want to do is enhance your quality of life. And the way to do that is utilizing hydration as a vehicle to deliver the products that can help you, the individual, do that. And at our facility, that is exactly our focus. It's on each individual patient and what nutraceuticals will work for what it is they wish to accomplish with their goals for the new year.
Explain, and you've done this many times, but we're kind of taking an approach of starting over, New Year's resolution, that kind of thing. Explain the difference, and vitamin C is always a great example. Yeah. I take 1,000 a day, vitamin C. Forget about it. You always say that, forget about it. The difference between vitamin C from the health food store and the vitamin C via hydration.
Well, first of all, there are different forms of vitamin C. I believe in natural extracts of vitamin C, depending on what you're coming to us for. We can extract vitamin C from beets. That has a little sugar in it. We can extract it from tapioca, less sugar. We can extract it from citrus fruits. So you really got to know, where's your vitamin C coming from, right? Because somebody who has diabetes, I want to use a vitamin C that's probably got less sugar in it. But more importantly, 1,000, that's like a drop in the ocean compared to what we can do in the bag.
Exactly. And you can probably say the same for a lot of other nutraceuticals,
but
right?
Again, I don't want people to think more is better. No, you want to, first of all, we want to make sure that our patient can utilize that vitamin C. It's a very simple blood test that does it. Then we want to make sure that we're giving enough vitamin C, and there's a urine test that we give in particular to most of our after every treatment to most of our cancer patients to make sure we're getting that reserve up for them, because we know that vitamin C helps give them a better quality of life, and there's some data about vitamin C in cancer care.
And you've used that not only with your cancer support patients, but we talked about it all last year about COVID-19 and the immune system. And that really has, I mean, I always feel like I have a little bit of an edge because of your facility.
There's some data that shows that it has an antiviral effect. Okay? It's not first-line defense to antivirals. There's a lot of antiviral medication out there. Just keep listening about COVID. You'll hear it.
Yeah.
So, but the point is, if your immune system is tuned up and it's fine-tuned, maybe you don't need those medications.
All right, we're coming up on a break, kind of the halfway point of the show, and we're talking New Year's resolutions, and if you've made a resolution to get healthy or to get healthier than you've been, well, you've come to the right place, because we have a lot of information we're putting out there, and we have more to talk about here on the show. Dr. Molly Fantasia is here. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, and our number here in the studio. We do have some open lines, so if you want to jump in, you made a New Year's resolution, you want to get healthier, but you don't know how to do it, well, now's the time to call in. 855-839-1210, 855-839-1210 with Dr. Molly Fantasia. I'm your host, John DeMasi. We're coming back. More of today's version of Health Watch after these words. Back here on Health Watch, operators standing by right now. If you have any kind of a question, you're a bit bashful to come on the radio, that's okay. 856-489-0505. 856-489-0505 is the number. It's Innovative Medical Associates, Marlton, New Jersey. You have any kind of a question, or you want to make an appointment to sit down with Dr. Molly, remember, the initial consultation is complimentary. 856-489-0505 is the number. And remember the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And, of course, our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. If you have a question right now, number in the studio is 855-839-1210. We talked a lot about this towards the end of last year, Dr. Molly, It's your men's health program,
Right.
which you're beginning in, what, a couple of weeks, right?
By the 15th.
By the 15th.
Absolutely. We have the instruments in. We've all done several seminars and several we've actually used it on patients. So everybody's getting used to this. We're using acoustical wave, but it's interesting. I got into this because of one of my own patients who actually listened to other ads about men's health and went out there because he said, "Oh, no
surgery, right?
No,
yeah.
this, that, and the other thing." It's been very interesting. So I tried to track how he was doing in this past year, and he said, "Oh, well, Dr. Molly, it works. You do get your erection, but you can't sustain it."
Yeah.
Well, guess what? I had a lot of men who came to see me post that with their wives or their significant others, and every one of the women were complaining about this. So, I started to look into the technology of what they were doing. I did the research on it. I tried to look at the best instrumentation out there, and I decided to go into this in addition to what we use for the men's health in terms of the hydration therapy. And why do I do this? Because, yes, does it improve blood flow by going after things like plaquing in that area? Yes. But the real key here is it takes 40 cc's to sustain. And guess what? You can't do that if your heart's not working properly. You can't do that if you have plaquing systemically from head to toe. You're not going to be able, yes, you'll be able to have somewhat of the ED solved, but you'll never have enough to please a lot of your partner.
Yeah. What did you call this machine? A wave?
Acoustical
wave?
Yes.
And now what does this do?
It's actually the waves. It sounds, folks, it's pretty loud. It sounds like when you go in for a CT and you hear that boom, 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 boom,
yeah,
boom.
Yeah.
You know that the wavelengths are going in. And what it does is it actually can open up the vessels in the localized area. It can reduce the plaquing in the localized area. But listen, be smart. You don't have to be a plumber. I'm a plumber's daughter, so I think of it in terms of our universal piping. So let's say your clog is above that, right?
Yes.
Okay. So you are getting some blood flow down there, and it's now improved because you're getting some of the blood to move down there, right? And now you may have a little more blood in that localized area. You still have a clog above that. So do you think you're getting enough blood to sustain? No. No. That's it. It's like opening up the pipe in your house. You need it from head to toe, not just in the localized area. Agreed that if there are vessels there that are deadened or old and shriveled, those kinds of things, this instrument will absolutely help you with that. But imagine putting this together with the hydration that we use that will ultimately open up blood flow head to toe 12%. Then we enhance that blood flow in the localized area by helping regenerate new blood vessels or going and opening up the ones that are damaged. Think about how much more powerful this is going to be.
So this acoustical wave plus your hydration,
chelation in particular,
chelation,
or plaquex in
this
particular.
will increase blood flow
12%.
And so that men can sustain
right
what
and
they couldn't prior to this.
Right.
Okay.
And do you think it's, and listen, it's not, there's a commercial out right now, and one of the football stars says, "Oh, take this. It's going to help you," and she's going to love it too. Well, let me tell you something. She's going to love what we do because it's proven that we know the acoustical wave works. That's not the issue. And we know that it works for what it does. And by the way, this is an instrument that can also be used in other areas. It has a lot of pain relief in certain areas that we can use it and will for our patients. I've actually woven it in to some of our other protocols. So again, there are lots of things you can do with certain instruments that we didn't have 10 years ago or 5 years ago, along with our protocols.
I know you mentioned to me, we've talked about, I've had a back problem for a while, and you said to me, I can
I'm going
use
to put
this.
you on there. We're going to use it. Our physical therapist is going to use that on you. Now, it is not a covered physical therapy modality. Well, it's sort of like chelation. it's not covered either. Doesn't mean it doesn't work.
Right.
It does. And when you read the European literature, and believe me, listen, it took me a full year to decide which one of these acoustical wave instruments I wanted. And believe me, there was a gamut of them. But I got the Mercedes of it. And it's top of the line.
I remember you told me that you were researching it, and then you found the one.
Absolutely. And I went and I looked at each and every one, because we don't just throw something into our clinic.
We're talking about this men's health protocol procedure that Dr. Molly is instituting beginning in mid-January. And we're talking about this acoustical wave and chelation, but what other elements are behind this or involved with this?
I would say that, of course, we're going to look at testosterone in terms of hormone. We might look at some other types of medication for men's health, traditional medication. However, again, when I looked at this and had a nice discussion with my medical director, I'm looking at possibly using some other types of medication that maybe like the blue pill, but certainly in a different dosing that is there, and having something compounded with its active ingredient. So there's going to be a lot of individual types protocols based off the regular protocol or the traditional protocol.
It sounds like what you're doing with this men's health, whole overall men's health procedures, is what you've done pretty much all your life with innovative.
We want to be innovators in this, in that we're not just going to say, okay, so this is the protocol that urologists are doing to make a few extra bucks in their clinic. No, I want to take this and say, okay, it's not just to look at the money that we can generate in the clinic. And by the way, you're going to be surprised at the cost as compared to what's going on out there and what they're charging. Because what I want to do is weave it into your overall health, which I think is really the right way to look at this. Most men who have this problem have it in their 40s to their whatever, basically because hormones change, comorbidities creep in, like diabetes, right? Cardiac conditions creep in. So there are so many things to look at. So you just don't say, oh, yeah, go in, get an acoustical wave somewhere, and it's going to solve all your problems. Nah, that's one size fits all. Nope, we don't do that.
This whole men's health situation, and you're saying you're going to start around January 15th.
I would say right in the middle of the month.
Right. Yeah. So somebody who signs up for this.
Yes.
And how long does this go on? A month, 2 months, 3 months, or what?
What we're going to try to do is we're going to do this twice a week for 1 month. That'll be the first phase. And then we might go down to once a week, okay, with an additional hydration in between for the second month. So we're going to work some of these things out, and I've got pretty much the plan. We think the overall deal is going to be approximately 3 months.
Well, that's similar to a lot of your hydration protocols.
Exactly right. Because, listen, John, none of us get to this state in, 2 weeks, okay?
Right.
We get to these metabolic states after years of living, and being exposed to toxins and having hormonal fluctuations and all of those things. The other thing I want to say is when we're doing this, we definitely don't want to do this in a vacuum. Again, I'm going to stress that there are sometimes comorbidities that have contributed to the men's health problem. And we want to look at that, right? And say, okay, what can we do to help these guys with their overall health, which then will what? Improve their overall quality of life, not just their sexual quality of life.
Which leads me to my next question, which is there anything that would prevent a man from signing up for this? Any comorbidities? For example, me, I've got a bunch of them. So
yeah, well, diabetes won't. Diabetes might be something we do. Cardiac conditions can be taken care of. Hypertension or hypotension could be taken care of. I would say possibly if there were some surgical interventions in the genitalia, that might be something that prohibited this. And again, what we're going to do is look at what most men have. In other words, most of the guys who come into our facility generally have the everyday comorbidities, diabetes, low hormones, some of the cardiac issues, the plaquing, etc.
What's the difference between and obviously I know it's thorough, between your Men's Health whole situation and a guy can say, "Oh, I'm just going to get the little blue pill"? What's the difference?
Oh man, you could take the
major
little,
difference, right?
How about you take the little blue pill and it doesn't work? How about that?
Yeah.
It's happened.
Yeah.
It's happened. Now, you may want to have the little blue pill in addition to some of the things we do, and we're not against that. You know that from previous. What we want you to do, here it is. Again, John, it's about quality of life. Don't be myopic in your thinking. This is the only thing in your life that you're worried about. No, this is a symptom of what else is going on.
Right.
Don't ever forget that.
Yeah.
Okay?
Okay, well, if you want more information about the Men's Health protocol that Dr. Molly has developed and will be starting, you certainly can call the operators right now at 856-489-0505, and we'll give out that number again right after the break. And we are coming up on our final break of the morning, which means you still have time to jump in if you have a question, not only about the Men's Health situation, but about anything that we've talked about here today on the show. 855-839-1210 is our number here in the studio, 855-839-1210. Our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Back here on Health Watch, again, operators standing by right now at Innovative Medical Associates. And you can call them if you like to get more information, 856-489-0505. You can call now, or you want to wait till after the show at 9 o'clock. They'll be there, and they'll be there this afternoon, and so on. So that is a number you can call during the week as well. 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey, and a lot of good information on the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And speaking of the website and the skincare products, it's one of those things, Dr. Molly, where you forgot somebody on your gift list. You say, oh, you know what? Let me go to the website and order that skincare product. Right, okay?
Let us take the blame.
Exactly, right, okay. InnovativeMedicalAssociates.com is the website. A couple of minutes left of our show. If you want to jump in and ask Dr. Molly a question, or you have a medical challenge you want to run by her, 855-839-1210. 855-839-1210 is our number here. 2020 was a very challenging year, Dr. Molly, but you were managing to get some patients and meet those challenges with some success.
You know, I have met so many remarkable people who've become our patients, and you know, their stories are going to be in the new book. And I'm overwhelmed with humbleness, because these folks really understood quality of life. And that's what they were all about, regardless of the fact that they had what they believed was, you know, pretty terrible conditions. For example, you know, I talked about Mary ongoing. Mary is a cancer patient that goes up to see the oncologist that I work with. She's doing so well. She had a little bout of anemia this past 2 weeks. We've straightened that out. She's going back up there this month, one time for her chemo. Again, these are the kind of cases. Tom's another patient of mine. Great guy. He's got a very serious cancer, unique, very, very unique, and he's taking immunotherapies. So again, he's doing so well. When he comes in, he's always smiling, and he said this is like the highlight of his week, because he's feeling good through his traditional treatment. I'm thinking about Pastor Matt, who had a wonderful service on Christmas, and you know, I'm just in awe of the fact that he's continuing all of his pastoral duties. He's out there and doing it, and he is recovering cancer. So it humbles me all the time to see what God's ingredients can do to help improve your quality of life. A couple of other people that are on my radar, Sister Fran. Wonderful sister in an organ. She's with the Clares, and they pray all day. And she said, I'm always holding your patients in our prayers. I can't ask for more than that. She came to us, again, traditional. She works with a surgeon that I have a relationship with, who I believe is a great breast surgeon. So again, I'm not telling people stop your traditional treatment. I'm saying let us enhance your quality of life no matter what the challenges that you're going through.
common denominator in all these names that you mentioned? Is there a common thread here?
The common thread is they thought out of the box. They weren't discouraged by their particular diagnosis, and they knew they wanted to continue their quality of life with their family, with their profession. They wanted to interact with people, and they wanted to be well doing it. In other words, as one of the pastors said to me, well, we all want to go to heaven. It's the question of how we get there on this earth. And that's really the common denominator. They all want to have a quality of life, whatever that means to them, right? Not everybody's the same. For me, my quality of life means getting into the office and trying my best to look at new cases and being challenged by new directions, and walking. I like to do a lot of walking on the boardwalk, as you know. But for other people, their quality of life is a simple quality of life. They want to get up in the morning, be with their grandchildren. And what I want to do is enhance that for someone. I want to meet the patient where they are.
It's so interesting. You were talking about all of these patients, and in particular, what comes to my mind is I know all of them.
Yes, you do, because you're there.
I'm there, and we talk, and Mary is truly amazing.
Oh, she is.
And,
she's tough.
We don't want to give out her age, but it's 80 plus.
Yes, yes.
So, I mean, and I didn't know it until you told me.
She's proud of it,
and she is.
Be,
but I mean, you would never know it.
No, and again, though, it's not just older folks. Look at Bella. Lovely Bella, who came to me from some type of disorder that I believe was post-Lyme, and all they were doing was telling her it was in her head and in her mother's head, by the way, was a registered nurse. Come on. This kid is now getting up on a walker or something. She came in a wheelchair stretcher, John.
And I saw her in the wheelchair, and I said to myself,
oh, my
this
gosh.
kid is probably no more than 18 or 19.
That's
and
right.
You told me she was 19.
Right now she's 19. She came to me a little earlier. But none of these things happened overnight. There's Sandy Payne.
That's another one. We'll pick that up in a moment. Let's go to the phones. Frank is in the Great Northeast. Frank, good morning. Happy New Year. Welcome to Health Watch.
Happy New Year, Frank.
I was being patient. No one's calling in, so I'm calling and say,
good.
Happy New Year, Dr. Molly, John, and everyone listening.
Thank you, Frank.
And you too, my friend. You too. You have some challenges. You are a very interesting case to me, and I wish, again, Frank, I wish this was holy water for you. It's going to take a little time.
Well, I got to talk. You told me to call you tomorrow. I will be calling you tomorrow.
Okay.
But I want to say Happy New Year to all your listeners and to you,
God
your
bless
crew,
you.
and John.
Thank you, Frank.
Thank you, Frank. You are a wonderful guy.
Did you make any resolutions, Frank, other than to get healthy?
Yeah, I did. I promise to lie more.
God bless you, my friend.
Okay.
He's a wonderful guy.
I know.
And you know what?
Frank, thanks for the call.
Thank you. And that's the thing. The thing is, our patients turn into a subset family. They enjoy talking to each other, sharing information, which I really appreciate, because most of my patients, in fact, all of them, I'm going to say, are pretty intelligent, John.
Yeah. In fact, I was mentioning to you during the break, one of your patients, we were sharing some information on the whole men's health situation the other day.
That's how I got into it.
Right.
He was the catalyst by which I decided to get into this, because he's telling me, it's working, but it doesn't seem like it's working in his best interest.
Yeah, we always talk about, well, how long does someone come into you, and I guess it's different. I mean, you take me. And people have asked me in the clinic, how long have you been coming here? When I say 20 years, they like, I look back like, well, wait a minute. So it's an ongoing maintenance thing, correct?
What we're trying to tell people is, again, don't look at this as a treatment. We're not curing your condition. What we're doing is enhancing your quality of life, regardless of what your challenge is. What we're doing is trying to keep your immune system tuned up as high as it can be, given the problems that you have. Does that make sense, John?
Absolutely makes sense.
That's the deal.
Yeah. And so if you want to start, in other words, if you want to say, look, it's a new year, I'm going to get started.
Sure.
Where do you start?
Call the office, get a free consult. Let's talk, chat about your goals, tell me what's going on. And if we can help you, we will. And I certainly will give you some guidance I really try to help people and meet them where they are. If they need some recommendations for traditional care, I will do that, as you know. And, I have a network of folks out there who work with us, and I'm grateful to all of the physicians who are brave enough to do that.
It's like you want to make the resolution, and sometimes it's a little difficult to do it. Can you give us any advice as to maybe cutting down the difficulty of saying, all right, I'm going to do this, I'm going to start now?
Look, I think the most important thing you can do is, we have one body. We're given this one body by God, and we ought to try our best to keep it in as fine-tuned as we would our cars. We spend a lot of time thinking about our cars, right? Enhancing our
our vacation.
Right, or our vacations and enhancing our performance in those areas. And I want to say to all of my patients out there who are listening today, I start this new year with a whole lot of gratitude for each and every one of you and all of the information and advice that you give me, in addition to whatever little I can share with you guys. And I will tell you, I'm always in awe of the human spirit.
And it's a good note to end on, that if you do anything, get healthy. Get healthy in the new year. That should be your New Year's resolution.
Especially with all this COVID.
That's right. And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators will be there well after we leave you at 9 o'clock. You can give them a call. You want to make an appointment to sit down with Dr. Molly. You really want to do your New Year's resolution to get healthy? That's what you do. 856-489-0505. That's the number for Innovative Medical Associates. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, we have Barbara, we have delightful Dee, fabulous Fran, we have Joanne, and we have our nurses Jess and Crystal, and of course our medical assistant Kathy. I'm your host, John DeMasi. Thanks for listening. Happy New Year. We hope it's a better one for you in 2021. We'll do it all over again next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.